In this video, I'm going to show you how to self-adjust the chest bone, including the front ribs and sternum, so stay tuned. Hey everyone, Dr. Rowe here at SpineCare in St. Joseph, Michigan. So this technique is going to be very effective for front rib pain, especially due to costochondritis, or the irritation where the ribs attach to the sternum, chest bone, or the breastbone. It also will help if it feels like a rib is just out of place. It needs to be popped back in. It's very safe to do. It doesn't take any special equipment, just your hands and some time. So let's get started with it. So to begin with, we really need to focus on getting a good contact point for this self-adjustment. That's very important. We're going to start off in the area of the chest bone, or the sternum right here. The areas that we're going to contact are the ribs that come off to the sides. These can be very sensitive areas. There's a lot of nerves in that area, so be very gentle when we start to do this self-adjustment. How we're going to find the ribs is just like this. So I'm going to break this down into a very easy step-by-step guide. First, let's just go over the sternum, or the chest bone. This is the starting point. You're going to then go to the side that your rib is irritating you. So let's say that it's on my left side. I go over that generalized area, and now I need to find the exact rib that's hurting. So I press into it. Once I start to feel sensitivity, I then want to separate or isolate that rib, the one that we want to adjust. I'm going to take two fingers and I'm going to start to roll over that area to find that particular rib. So in this case, I feel it right there. It should feel, again, just like almost a nice rounded mound of bone. So once we find that particular rib that we want to adjust and we isolate it, we then need to trace it back to the center over the sternum or the chest bone. How we're going to get our contact point is we're going to take our thumb and then we're going to press into there. You should really start to be able to press off to the side and feel a good amount of sensitivity. The ribs are very sensitive. They have what are called intercostal nerves in there. So what I like to do is take this part of the palm right here and put it directly over that spot. I'm going to push into it to get tissue tension, and I'm going to pull over and then go up with it towards my shoulder. So watch this. I'm going to put it right there. I'm going to pull over and I'm going to go up with it. That rib is really isolated right there at the edge of that palm. From there, I'm going to take a deep breath in, and this is going to expand the rib cage. I'm going to try to build just a little bit more tissue tension in there. I'm going to then raise that side shoulder up like this. I'm going to bring it back into a pec stretch. This is going to put a lot of tension into that area. I'm maintaining pressure, and then from there, I'm going to lift up as much as I can with that hand, putting contact onto that rib, and then roll that shoulder forward as much as we're able to while we're taking this hand upwards. You may feel a pop, a click, or even somewhat of a cracking sound into that rib if it feels like it's dislodged and it goes back into place. The odds are you might not hear anything, but after doing this several times, you should be able to feel the tension release and have a lot more freedom to be able to breathe and move without that rib irritating you. So another technique to adjust your chest bone, sternum, or the front ribs is with a modified door stretch. So what I'm going to do is stand in a doorway. I'm going to put the affected side up just like this. I'm going to do that same contact point that I did earlier. So I'm going to find that rib. I'm going to take this part of the palm. I'm going to press into it. I'm going to go over as much as I can to build tissue tension. I'm going to then turn and then lift up on it towards that shoulder. Once you have a lot of tension build up at the edge of that rib onto the sternum, you're then going to lean forward with your body weight and keep contact on that rib. You should feel a lot of pressure being built up. You just keep leaning up into it. And then from there, if you feel like it needs just a little bit more, you can press up into the rib. But the odds are that stretch right there, it's going to help expand the rib cage, and it's going to allow that rib to be popped back into place. And again, you might feel a pop, click, or a cracking sound over the chest bone or over that rib. So again, as a quick reference, I'm going to just find that rib. I'm going to take that palm, press into it, go up, over, and then lean into it. and then hopefully you're going to get a lot of relief with it once that does feel like it goes back into place. So give it a try. If you liked the video and got a lot of relief, please show us your support by giving this video a like and maybe subscribing to our channel too. If you have any comments or questions, please leave them below and I'll get back to you as soon as I can. Thank you for watching.